Welcome back to the deep dive. We know a lot of you are looking for ways to, well, boost your respiratory health, but also, crucially, how to do that without breaking the bank on supplements.
Yeah, it's a huge market out there, isn't it? And frankly, it's easy to feel overwhelmed and end up spending money on things that,
Yeah,
well, that don't really work.
exactly. Which brings us to our focus today, a new book that aims to cut through that clutter. It's all about evidence-based guidance for choosing the right supplements for respiratory infections.
And saving money in the process because it helps you avoid the duds. The core problem it tackles is just that sheer volume of choice leading to guesswork and wasted cash.
So how does it do that? What's the approach?
It uses a really clear methodology. Basically, it ranks supplements based on the actual scientific evidence, how well they're proven to work for respiratory infections.
Okay, so no marketing hype, just the science.
Pretty much. Our goal here is to pull out the key takeaways from this book so you can feel more confident making those choices and hopefully keep a bit more money in your wallet.
Sounds good. Now, before we dive into the specifics, there's an important disclaimer we need to cover, right?
Absolutely. The book makes it very clear this is for educational purposes only,
Yeah.
aimed at adults 18 and over. It is not medical advice.
Right. Always talk to your doctor or healthcare provider before starting any new supplement. That's crucial.
It really is. Individual results can vary a lot, and you've got to consider potential interactions with foods, medications, other supplements, and any health conditions you might have.
Good reminder. So, beyond the disclaimer, what are the main aims of this guide?
It really have two core goals. First, to help you figure out which supplements might actually be right for you, based on the evidence.
Okay, personalized decisions.
Exactly.
Yeah.
And second, it guides you on how to potentially combine supplements that work well together, synergistic ones, to get the best possible effect.
Combining things effectively, not just randomly grabbing bottles off the shelf.
Precisely. And central to that first goal is the ranking system we mentioned.
Tell us a bit more about how that works.
It's straightforward, really. Supplements are ranked from highest discovery, those with the strongest scientific proof, for helping with respiratory infections, right down to those with the least convincing evidence.
So it gives you a clear hierarchy. You know where to focus your attention and maybe your budget.
That's the idea. It helps prioritize based on science, not just popularity or marketing claims.
And you mentioned combinations.
Yes, the book proposes a strategy using what it calls a core combination for general prevention, sort of a baseline.
Okay, a foundation.
Right. And then it offers several specialized combinations designed for more specific needs or situations. The idea is you might combine the core with a specialized one that fits your goals.
Makes sense, tailor it to your own situation. Now, to understand how these supplements might even work, the book touches on respiratory infections and immunity, right?
It does. It gives a quick overview how infections affect the respiratory tract, from sinuses down to the lungs, and critically, the role of the immune system.
Our body's defense network.
Exactly. It talks about the epithelial tissues, the lining is that first barrier, and then how both the innate sort of immediate response and the adaptive, more specific response work to fight things off.
And nutrition plays a part in how well that system works.
A huge part. The book emphasizes that your nutritional status directly impacts immune function. Deficiencies in certain vitamins and minerals, well, they can definitely weaken your defenses.
But that's the underlying rationale for considering supplements.
It is. The idea is to potentially fill those gaps or optimize function. It touches on how these infections challenge both the quick innate response and the longer-term adaptive immunity.
So how do these supplements supposedly help? What are the mechanisms the book outlines?
It details a few key ways. First, supporting that epithelial barrier function we mentioned, keeping the lining strong.
Okay, the first line of defense.
Second, enhancing those innate immune responses, helping the body's initial fighters work better. Third, modulating inflammation, which is important because too much inflammation can be damaging.
Right, keeping it balanced.
Fourth, some might have direct antimicrobial or antiviral effects, although that's often more seen in lab studies. And fifth, supporting a healthy gut microbiome.
Ah, the gut-lung axis again.
Yep, but a really crucial point the book makes, and this ties back to saving money, is that supplements are most likely to be beneficial if you're addressing a specific known deficiency.
So not just taking things randomly, hoping for the best. Test, don't guess, perhaps.
Ideally, yes, or at least be aware that the biggest benefits often come from correcting an existing lack of something.
Okay, let's get into the specifics then. Which supplements does the book highlight? Starting with the ones with the best evidence.
Right at the top, based on the evidence for respiratory infections, is vitamin D.
Okay, vitamin D. We hear a lot about it for bones, but immunity too.
Definitely. It's critical for immune regulation. It interacts directly with immune cells through vitamin D receptors, influencing both innate and adaptive responses.
How does it do that?
Well, it seems to help immune cells like macrophages fight pathogens more effectively, but also helps dial down excessive inflammation. And crucially, lots of studies link low vitamin D levels to a higher risk of respiratory infections.
And does supplementing help?
The evidence suggests yes, especially for prevention in people who are actually deficient, typically meaning serum levels below 20 nanograms per milliliter. Randomized trials show it can cut the risk of acute respiratory infections.
By how much, roughly?
The book mentions figures ranging from maybe 8% up to 40%, with the biggest effects seen in those starting with low levels.
Significant. So what's the recommended dosage?
The official RDA is around 400-800 IU, but the book suggests the 1,000 to 2,000 IU daily is probably suitable for most adults for prevention.
Okay.
Higher doses, like 20-80 IU per kilogram of body weight, might be used for deficiency, but that needs medical supervision.
And how should you take it?
Daily, ideally in the morning, and with food that contains some fat because it's fat-soluble helps absorption. Maybe avoid taking it late at night.
Any downsides or things to watch out for? Toxicity?
Yes, definitely. It can be toxic if you take way too much for too long. Consistently over 10,000 IUs a day for months is risky. Even doses over 4,000 IU daily can cause problems like high blood calcium, nausea, weakness, kidney issues.
So more isn't always better. Stick to recommended doses.
Absolutely. And there are potential drug interactions too, things like statins, certain diuretics, heart meds, steroids. Worth checking.
Okay, vitamin D, strong evidence for prevention if deficient. What's next on the high evidence list?
Zinc, another essential mineral, really vital for immune cell development and function. Plus, it has some direct antiviral properties.
And the evidence for colds.
It's particularly strong for reducing the duration of the common cold, specifically using ionic zinc lozenges.
Lozenges, okay. How do they work?
The thinking is they interfere with the virus replicating in the throat and reduce how well it can stick to the mucous membrane.
Does this make a big difference?
The book cites data suggesting lozenges with 10-15 milligrams of elemental zinc, taken every 2-3 hours while awake, but not more than 100 milligrams total per day, can shorten a cold by about a third. Wow, that's quite a bit. Any preventative effect.
Some studies, particularly in Asian children, suggest a protective effect against viral respiratory infections. But the main evidence is for shortening duration. Again, avoid high doses long-term. Over 100 milligrams a day can be toxic.
So what are the dosage recommendations?
For prevention, maybe 5-10 milligrams daily. If you're actively sick, those 10-15 milligram elemental zinc lozenges every few hours, capped at 100 milligrams daily.
And elemental zinc, that's the actual amount of zinc.
Yes, exactly. The label should specify the elemental amount. Also, don't take it at the exact same time as high doses of calcium, iron, or magnesium. They compete for absorption.
Good tip. Side effects.
Acutely, with higher doses over 100 milligram a day, you might get nausea, vomiting, diarrhea, a metallic taste. Chronically, if you take over 40 milligrams a day for a long time, it can lead to copper deficiency, anemia, lower good cholesterol, even prostate issues.
So again, caution with dosage. Any major drug interactions?
Yes, certain antibiotics like tetracyclines and quinolones, cisplatin, AC inhibitors, proton pump inhibitors need to be mindful. Okay, zinc, good for shortening colds via lozenges. What about the classic vitamin C?
Yes, vitamin C, or ascorbic acid, probably the most famous immune supplement. It's a powerful antioxidant, supports those epithelial barriers, helps immune cells like phagocytes work, promotes T-cell production.
Yeah.
It does a lot.
But does it prevent or treat colds effectively? The research seems a bit mixed, doesn't it?
It is a bit mixed, according to the book. Regular supplementation doesn't seem to do much to prevent colds for most people. Maybe a slight benefit for those under intense physical stress, like athletes.
Okay, so maybe not a general preventative powerhouse. What about treatment?
There's more consistent evidence that taking it regularly or starting at the onset of symptoms might modestly reduce the duration and severity of a cold.
How much reduction?
The book suggests therapeutic doses, like 1,000 to 2,000 milligrams per day, might shorten a cold by around 20%, but high doses, say over 500 milligrams at once, can cause some digestive upset for some people.
Right, the dreaded GI issues. So dosage?
Typical range is wide, maybe 200 milligrams up to 2,000 milligrams daily. Higher end often used during infections. But moderation is key because of that potential stomach trouble.
And very high doses. Any risks?
Yeah, over 2,000 milligrams a day can lead to diarrhea, potentially kidney stones in susceptible people, and maybe iron overload issues.
Interactions.
Could interfere with some chemotherapy drugs. Taking it with aspirin or NSAIDs might increase stomach irritation, high doses might affect warfarin, and it can increase aluminum absorption from antacids.
So vitamin C maybe shortens colds a bit, but prevention is less clear for most. And watch the dose. What comes next?
Probiotics and fermented foods. This ties into that gut-lung axis concept, the idea that a healthy gut microbiome influences your systemic immunity, including in the lungs.
Okay, so bugs in your gut affecting your breathing.
In a way, yes. Probiotics are those live beneficial bacteria. The research suggests certain strains, especially some Lactobacillus and bifidobacterium species, might reduce how often you get upper respiratory infections and how long they last.
How do they do that?
They seem to strengthen the gut barrier, produce substances that fight bad microbes, and modulate immune cell activity.
And fermented foods.
Things like yogurt with live cultures, kefir, sauerkraut, kimchi, kombucha, they're natural sources of these kinds of beneficial organisms.
So supplements or food, what's the verdict?
The book mentions multi-strain supplements with 1 to 10 billion CFUs, that's colony-forming units per day, have shown some promise. Either food sources or supplements may be beneficial.
But it's specific strains, right? Not all probiotics are the same.
Exactly. The effects can be very strain-specific, and the book notes more research is needed to nail down the best ones for respiratory health.
Any side effects? Usually pretty mild, right?
Generally, yes.
Mm.
Maybe some temporary gas, bloating, or constipation as your gut adjusts. There's a very rare risk of fungemia, a fungal blood infection, but mainly in severely immunocompromised people.
Interactions.
Antibiotics can kill them off, obviously.
Uh-huh.
Possible interactions with immunosuppressants and some other common meds.
Okay, probiotics linked to the gut, potentially helpful strain matters. Moving down the evidence list.
Next is garlic. Allium sativum, known traditionally for ages, right? It has antimicrobial and immune-enhancing properties.
What's the active stuff?
Allicin is a key one. Lab studies show it fights bacteria, viruses, fungi. Some clinical trials suggest garlic supplements might reduce how often people get colds and help them recover faster.
So does it work in practice?
The book mentions one study where people taking garlic supplements had fewer colds and got better quicker than a placebo group. Aged garlic extract, specifically at 600 to 1,200 milligrams a day, showed benefits in some studies. Even raw garlic seems to influence immune genes.
Interesting dosage.
Maybe 1 to 2 cloves of fresh garlic daily, or 600, 1,200 milligrams of aged garlic extract.
Downsides, apart from the obvious.
Yes, apart from potential bad breath. It can cause GI upset for some, and allergic reactions are possible. And it can interact with certain drugs.
Like what?
Blood thinners, anticoagulants. It can increase bleeding risk. Also, potentially HIV protease inhibitors and blood pressure meds.
Good to know. Garlic, some promise, especially aged extract, watch interactions. What about ginseng?
Ginseng, both American, Panax cuncifolius, and Asian, Panax ginseng. Another one with a long history for immune support. The active compounds are called ginsenosides.
And they do what?
They're thought to modulate immune responses and might have some antiviral effects. Studies using standardized extracts look promising for reducing respiratory infection incidence and severity.
Any specific examples?
Some studies found American ginseng extracts reduce cold frequency and severity during winter. The book mentions moderate evidence for symptom reduction, particularly shortening cold duration in older adults, using 200-400 milligrams daily of standardized extract.
Standardized extract, that seems important.
It is, for consistency. The book also suggests using it cyclically, maybe taking breaks due to potential long-term effects or interactions.
Caution needed with?
Definitely if you're on meds affecting blood clotting or blood sugar. Side effects can include insomnia, maybe high blood pressure, or menstrual issues with long use. And watch out for adulterated products causing liver issues.
Interactions.
Again, anticoagulants, also anti-diabetic drugs, and MAO inhibitors.
Okay, ginseng moderate evidence, use standardized extracts, cycle it, be careful with other meds. Next.
Pelargonium sidoides, also called mucoloabo or South African geranium.
That's a mouthful. What's it good for?
The evidence points mainly towards reducing the severity and duration of symptoms, particularly for acute bronchitis, not so much for prevention.
How does it work?
It contains compounds called prodelphinidins that might stop bacteria from sticking to the lining of the throat and lungs. Best used early in an illness, especially one starting with a dry cough.
So mainly for bronchitis treatment, taken early.
That seems to be the main indication based on the evidence cited. Dosage varies by age, using a specific extract called EPS 7630.
Side effects, interactions.
Common side effect is GI upset, Rare but serious things like allergic reactions or liver issues can occur. Potential interactions with blood thinners and immunosuppressants. Avoid if you have liver-kidney disease, are pregnant breastfeeding, or have autoimmune conditions. Got it. Pelargonium, mostly for bronchitis symptoms. Take it early. What else is covered?
Tinospora cordifolia, or guduchi, an herb from Ayurvedic tradition.
And the evidence.
Limited, according to the book. It might help with allergy symptoms like nasal congestion. There's also a suggestion it could help prevent infections by boosting white blood cell function, maybe synergistically with garlic, but more research is needed.
Dosage and cautions.
Specific doses are given for standardized extract, raw powder, and tincture. Side effects are usually mild GI or nasal discomfort, but it could potentially worsen autoimmune diseases. Interacts with diabetes meds and immunosuppressants. Stop 2 weeks before surgery. Avoid in pregnancy, breastfeeding, prostate cancer, autoimmune conditions.
So limited evidence, lots of cautions.
Next,
Echinacea.
Echinacea purpurea, one of the really well-known immune boosters.
Does it live up to the hype?
The book suggests it may reduce the risk of catching a cold if you take it regularly, like throughout the cold season or during high-risk times.
But not shorten cold once you have it. Probably not significantly, but it might reduce the risk of complications. The big caution with echinacea is its potential for drug interactions, many of them.
Right, definitely need to check with a doctor or pharmacist.
Absolutely. It's specifically contraindicated with immunosuppressants. Dosage forms, vary capsules, tinctures, tea, usually recommended for short-term use, like up to 10 days, not generally for longer than 8 weeks straight.
Side effects.
GI upset, allergic reactions, especially if you're allergic to ragweed. Rare issues like fever or worsening of autoimmune conditions, contraindicated in HIV/AIDS, MS, PB. Caution in pregnancy, lactation, and kids.
Echinacea maybe lowers risk, doesn't shorten much, lots of interactions and cautions. Is there one more individual supplement?
Yes, spirulina. It's a type of blue-green algae.
What's the potential benefit here?
Limited evidence, again, mainly suggesting it might help reduce nasal allergy symptoms, sneezing, stuffy nose.
Right.
It's rich in protein and has anti-inflammatory compounds, but more research is needed on infection prevention.
Dosage and safety.
Standard range is 110 grams a day, often for at least 12 weeks. For allergies, 2 grams daily was used in studies. Big caution. Avoid during pregnancy breastfeeding due to potential contamination risks and some reports of issues.
Contamination.
Yeah, algae supplements can sometimes be contaminated with heavy metals or toxins, so buying from a reputable source is crucial. Side effects are usually mild GI upset, rare allergies, could potentially worsen autoimmune diseases.
Interactions.
Theoretical risk with blood thinners, may interfere with certain assays. Caution with immunosuppressants and autoimmune conditions.
Okay, spirulina, limited evidence for allergies, questionable for infections, source quality and pregnancy are key concerns. That covers the individual supplements ranked by evidence. What about those combinations the book suggests?
Right, it offers some practical, evidence-informed combinations. First is the core combination for general prevention.
The foundation we talked about, what's in it?
It's pretty simple. Daily with meals, vitamin D, 1,000–2,000 IU, then 3 times a day with meals. Garlic, 1 to 2 cloves, or 200–400 milligram extract, and vitamin C, ascorbic acid, 500 milligrams each time.
And the key is consistency, right? Taking it before you get sick.
Exactly. It's meant for ongoing prevention.
Then there are the specialized combinations.
Yes, tailored for specific situations. For instance, for people who tend to get sick easily, it suggests adding Tinospora cordifolia and Echinacea purpurea at specific doses 3 times daily to that core combo.
Okay, an extra boost for frequent sufferers.
Another one is for when you feel a sickness coming on, especially with a sore throat. Add pelargonium sidoids, specific dose 3 times daily before meals, and zinc acetate lozenges, 75–125 milligram total elemental zinc per day to the core combo, just for about a week or until symptoms clear.
An acute care protocol.
Sort of, yeah. And for people with chronic stuffy nose issues, it suggests adding spirulina, 2 quarts a day, and Tinospora cordifolia, 300 milligrams 3 times a day to the core combo, potentially year-round.
Interesting, specific protocols based on needs. Did it mention any less scientific combinations?
Yes. It includes a section called Combinations of Grandmothers. These are traditional remedies, explicitly noted as not scientifically proven.
Like what, out of curiosity?
Things like an onion and honey mixture for severe coughs, or honey and warm beer. Also for coughs. Blackcurrant leaf tea for nighttime coughing. Fresh garlic and honey taken right at the first sign of a cold.
Okay, interesting folk remedies, but separate from the evidence-based stuff.
Definitely presented as tradition, not science. The book also includes a helpful FAQ section.
Good. Practical tips. Like what?
It advises waiting a few weeks between adding new supplements to see how you react. Always consult your doctor, research interactions yourself, maybe start with lower doses when combining things.
Sensible. What about dosages?
Stick to the recommended ranges. Don't exceed them by more than maybe 10%. More is often not better and can be harmful.
Important safety point. Anything on timing?
Yeah, follow specific advice if given, like vitamin D in the morning, maybe magnesium at night. Take fat-soluble vitamins, A, D, E, K, with fat. Maybe split doses of water-soluble ones like B vitamins and C through the day for better absorption.
And it clarifies that elemental zinc point we mentioned earlier.
Yes, reminding people that's the actual amount of pure zinc, which should be on the label.
Finally, the book offers some key precautions, right? General warnings for supplement users.
Crucial advice, yes. It reminds readers that supplements aren't regulated like medicines. Quality can vary wildly.
So check with the manufacturer, if possible.
A good idea. Also, herbal batches can vary. Interactions are often poorly studied. The safest way to start is one new supplement at a time, maybe starting with half a dose, giving it a few weeks.
Okay, slow and steady.
And remember, minerals and fat-soluble vitamins can build up in your body. Think about your diet first. Prioritize food sources.
Good point. Where should people buy supplements?
The book strongly suggests reputable pharmacies or health stores where you might get professional advice. Be wary of suspiciously cheap online deals. Without proper certification, you might get something ineffective or even harmful.
Buyer beware, basically. Check for quality and reputation.
Absolutely. It's key for safety and getting what you pay for.
So, wrapping up, this book really seems like a valuable tool for anyone confused by the supplement aisle, especially concerning respiratory health.
I think so. It empowers people to make informed choices based on evidence, not hype. And that directly helps save money by steering clear of things that likely won't work.
The detailed info on specific supplements, doses, interactions, it sounds like a really comprehensive resource.
It aims to be.
Yeah.
A practical guide through a complex area.
It definitely gives you a lot to think about. Which leads us to our final thought for you, the listener. With this kind of evidence-based knowledge, how might you reevaluate the supplements currently sitting in your cabinet?